Hello, I'm Samik Garg, Associate Professor of Orthopedics at the University of Colorado and a pediatric spine surgeon at Children's Hospital Colorado. Today, I'm going to discuss the systematic quality improvement approach that has been used by the spine program over the past 5 years to dramatically reduce blood loss during corrective surgery for adolescent idiopathic scoliosis. Scoliosis is a three-dimensional curvature of the spine that affects 1 to 3% of the population, boys and girls equally. Fortunately, most curves are very small and do not require any treatment. Curves that require treatment are 7 to 10 times more common in girls than boys for reasons that are not currently understood. In most cases, no cause can be identified for scoliosis, and it is termed idiopathic scoliosis. This X-ray shows a 55-degree curvature of the spine in a 13-year-old girl. The photograph demonstrates the impact the spinal curvature has in 3 dimensions, leading to shoulder imbalance, chest asymmetry, and a rib prominence on the convex side of the curvature. Progressive adolescent idiopathic scoliosis is the most common indication for spinal deformity surgery in pediatrics. At Children's Hospital Colorado, we do nearly 100 of these procedures for idiopathic scoliosis annually, by far the most in the Rocky Mountain region and among the highest volumes nationally. Despite excellent clinical outcomes, our program was not satisfied with the amount of blood loss during scoliosis surgery and our use of blood transfusions. In 2013, we began a focused and systematic effort to reduce blood loss and transfusion rates in scoliosis surgery. Key stakeholders from spine surgery, anesthesia, and the operating room staff worked together to incorporate best existing practices for minimizing blood loss in scoliosis surgery. Initial interventions included developing a spine anesthesia team, standardizing pre-surgical administration of long-acting intrathecal narcotic, and routine use of antifibrinolytic infusion during surgery. As you can see, these early interventions brought the average blood loss down from 1,100 milliliters to under 700 milliliters over the initial 2 years of the project, which was a 40% reduction. As we moved forward, we not only incorporated existing best practices, but began incorporating new innovations and practices to further reduce blood loss. These innovations over the last couple years have included increased utilization of powered tools for spine surgery to reduce the length of surgery, critically evaluating and eliminating surgical steps that are not required with modern technologies, and utilizing an ultrasonic bone scalpel for more precise bone cuts with less blood loss. We also routinely use blood cell salvage technology to be able to recover up to 50% of the blood that is lost during surgery and immediately return it to the patient. Lastly, we have narrowed the number of surgeons doing scoliosis surgeries at Children's Hospital Colorado from 5 to 2. Numerous studies in all fields of surgery have shown improved results and reduced complications when surgeries are done by high-volume surgeons. Each spine surgeon at Children's Colorado now does 40 to 50 adolescent idiopathic scoliosis surgeries annually, whereas in the past, there were several who did fewer than 10 to 20 cases annually. These latest interventions have continued to dramatically reduce the blood loss during scoliosis surgery. The blood loss now is about 1/3 of what it was 5 years ago. It has been over 3 years since any patient with adolescent idiopathic scoliosis having surgery at Children's Colorado has required a blood transfusion. Accompanied benefits of the reduced blood loss are also seen in our patients' recovery trajectory. Most patients now leave the hospital 2 to 3 days after their surgery and are back in school within 2 to 3 weeks. We are able to allow them to return to sports after their 1-month checkup appointment. We are not resting on these accomplishments. Our goal is continuous improvement, and we remain committed to improving success and safety of scoliosis surgery for both our patients and the larger community of scoliosis patients. We have reported our methods and results in peer-reviewed surgical journals and are active in teaching other surgeons around the world in best practices for scoliosis surgery. We would be happy to care for your patients. Please don't hesitate to contact the Spine program with any questions. Thank you for watching.